Sharon wasn't sure what was going to happen to her. Sometimes it seemed like no one understood her, and there was always someone new coming into her house to support her. Even though Sharon tried to keep calm, sometimes she expressed her needs in negative ways. To make things worse, the community home where she lived was going to close because Emmaus couldn't find enough staff, especially now with COVID. Sharon was going to have to move and find another agency to help her. But she had already been with so many other agencies, and none could support her the way she needed. She felt scared and worried, and she knew her parents worried too. Then Mary Jo, the one staff with whom Sharon really connected, decided Sharon could come live with her in something called a host home. Sharon was going to get to live with Mary Jo and her family. She was hopeful for the first time in a while. At Mary Jo's house, Sharon gets personal attention instead of competing for the staff's limited time. She is bonding with Mary Jo and her family. Sharon feels like she belongs and no longer needs to communicate through outbursts as much. Things are starting to look brighter for Sharon, and she can't wait to see what she can accomplish next. A host home arrangement, like the one Sharon lives in, is an innovative solution that Emmaus has really leaned into during these very challenging times. People with developmental disabilities experience better outcomes because they have more stable, consistent support. And for organizations like Emmaus, it's less staff intensive and less expensive. We help create the matches between the clients and the host home providers, and we provide the training and support to make sure that everyone succeeds for the long term. We think it's a win-win.
Hello, Wisconsin Conference of the United Church of Christ. I am coming to you from the Mississippi Gulf Coast, Biloxi, Mississippi, from Back Bay Mission, and I am in our mission house, and those of you who have been here to Biloxi probably recognize our mission house where all of our volunteers who do housing rehab stay during their time in Biloxi. So we're really grateful for this time to have a few moments to share with you about Back Bay Mission and our 100-year anniversary. So just to let you know a little bit about myself, it was actually in the Wisconsin Conference where I had my Lutheran ordination affirmed by you folks, good folks of the Wisconsin Conference of the UCC. From there, I moved to Minneapolis to pastor a church in Minneapolis, a UCC church, and then to Phoenix to pastor a church there, from the coldest to the very hottest city in our nation. So really excited now to be at Back Bay. Wisconsin holds so many memories for me from Stevens Point, Milwaukee, Madison, and Back Bay Mission. The beautiful thing about Back Bay is this year we're turning 100 years old. Talk about resilience and talk about stick-with-itness. We're celebrating with a capital campaign to meet the needs of the most vulnerable here on the coast. Those would be the unsheltered and those living in poverty. Our theme for our capital campaign and for our 100-year celebration is Making Good Trouble. As you would notice, is from John Lewis. I'd love to be with you actually during this time, but I'm actually preaching in NOLA this Sunday, or in New Orleans as we call it here, at Central St. Matthew's UCC for their Pride Sunday, and sharing a little bit about our 100th anniversary. But I encourage you to go to our website to learn more about our 100th anniversary celebration and our capital campaign. And as always, we encourage you to give to Back Bay Mission, especially during our campaign, and also to come down and visit us, volunteer, be a part of the change that we want to see in our world. So join us here at Back Bay Mission, Making Good Trouble on the Coast for 100 years into our next 100 years. Thank you for this time with you together here at the conference.
Crossroad Child and Family Services in Fort Wayne, Indiana has been serving children since 1883. Today, those are children with complex mental health challenges. This pandemic was not our first, but it led to many important firsts. We started a 4-year training process for a new treatment model. Children and Residential Experiences, or CARE, is a highly researched model from Cornell University. And we also rolled out Social Emotional Learning Day. Every Friday, kids are involved in recreation, learning teamwork skills, or in activities learning to break negative chains of thought, or making birthday cards for a senior care facility. And our school became a new tech academy. Through project-based learning, students work in teams to learn real-world abilities and prepare themselves for jobs and further education. Monthly, small groups of kids present a project. As we listened to a group of our boys tell about their projects about apples, 7-year-old Keegan, a small, slender boy with curly hair, started telling us how apples grow. He had trouble looking directly at us and had a slight speech impediment. He was obviously relieved when his part was done and the taller, more assertive Dakota started to tell about what makes an apple healthy. When Keegan handed us the bowl of applesauce they'd made, he was very excited, but still found it hard to look at us. After the presentation, our principal asked the boys what they learned working in a small group. Curly-headed little Keegan looked directly at him and without a hint of that speech impediment, said, "Mr. Dorman, I learned that sometimes if you don't know somebody or don't like them very much, when you work together on a project, you can become friends." And that's what a success looks like at Crossroad.
One of the many things that Orion Family Services did in response to the COVID-19 pandemic was to establish the Orion Emergency Assistance Fund. We dedicated $10,000 from our annual budget with a goal to keep it funded through COVID and beyond with donations. Orion's first family, we like to call them that because they were the first family to receive support from this fund, consisted of a single mom with 3 active boys, ages 2 to 8. The school-age boys especially had some very challenging behaviors. With no internet, Mom was driving to school each day with the kids and sitting in the school parking lot as long as possible so that the boys could access free Wi-Fi and attend school virtually. This, of course, was not sustainable for the length of the school day, so when things in the car got out of hand, they went home, where Mom struggled to try to support continued learning using worksheets provided by the school. The kids were not engaged in learning, Mom was coming unglued, and the whole family was really struggling. The Emergency Assistance Fund paid for the internet cost for the rest of the school year and headphones, one for each of the boys, so that this would support focused virtual learning in the home. Mom's response when she received her check was, and I quote, oh my gosh, thank you, thank you, thank you. I would hug you if COVID wasn't a thing. Which of course made us all laugh. Our staff was really gratified to be able to provide this kind of meaningful support in addition to the services we provide. This kind of support is a game changer for families in crisis. Thank you.